Next, I'm really excited to introduce Ankita Patel from REACHUP, which is located in Tampa, Florida. Sorry, one second. Again, a really short bio that doesn't really encompass all the amazing work that she has done. Ankita Patel is the doula program manager for the Growth with Doulas and Dads program. Previously, she worked with the Title V funded Center of Excellence in MCH Education, Practice, and Science at the University of South Florida. As a program coordinator, Ankita worked to engage graduate students in developing their skills and to become future MCH leaders. In order to gain a holistic view of the MCH public health profession, she transitioned to work as a Florida Kid Care Navigator, where her main focus was predominantly in the rural Treasure Coast counties. She is a graduate of the University of South Florida with her Bachelor in Science degree in Biomedical Sciences and an MPH in Maternal and Child Health. We're really fortunate to have her today, and she'll tell us all about REACHUP.
Hello, thank you for having me. Give me a second while I try to share my screen. All right. I cannot see anything beyond this, but
it looks good.
Okay, good. Thank you. Good afternoon. Thank you all for being present and allowing me to speak to you all on the work that the doula program here in Tampa, Florida has been working on in conjunction with the Safer Childbirth Cities initiatives to expand on our doula program. You should be able to see my wonderful team. Oh, hold on. My wonderful team on the screen. Our Safer Childbirth Cities initiative with the Merck for Mothers project really allowed REACHUP Incorporated to expand upon our doula initiatives that really focused in on birth. The Merck, our Safer Childbirth Cities initiative expanded into more of a postpartum. Like most, we started right at 2020, and it was a very interesting time to really work in postpartum health and how that impacted. But I am so proud of this picture. This is like one of the things I spend the most time on because it really shows like the diversity in our workforce development, as well as like the impact that these individuals have made on countless families within our community. A little bit more about our agency, REACHUP Incorporated. We started as a nonprofit out of the University of South Florida over 20 years ago and have really focused in on maternal and child health. Our agency really wishes to advocate for and mobilize resources to help our community achieve their best healthy selves and promote their ability to do that for themselves. Our vision is to be nationally recognized as a center of excellence, and we are always consistently motivated to research, education, advocacy for healthy living. We are working together with a lot of other programs. So the doula program is just one of the programs that REACHUP offers. We have both a federal and state Healthy Start. We have a few male involvement programs. We also have Pregnancy Medical Home, which is services located within OB clinics within our county. We have stress management, as well as nurse family partnership, predominantly home visitation programs. And the unique thing that we do at this agency is really able to build a holistic home for a lot of our participants within our community. And there you'll see a picture of some of my doula team at a REACHUP sponsored event. Our program, doula program, is really geared towards meeting women where they are, right? We want to offer these services in the capacity that they are seeking services, and it's not innovative in any way. It's not anything different that so many other community partners are doing, but we really want to make sure that we're not reinventing the wheel, just really connecting them to those resources. What you most often find is that there are a lot of resources out there, but navigating those resources can feel overwhelming on top of being pregnant and dealing with these changes in medical issues that any individual might have. So how are we as a community doula program celebrating our individual families and helping them navigate those, because it can be overwhelming, and giving them a positive experience. And we're meeting them where they're at by incorporating home visitation, education, and support in that environment. Some of our models is really focused in, and what our program really focuses on is our collaboration, not only with our community, but also with each other. I think that many on this call can really relate to the social and emotional burden that is community or work, and it requires a lot of energy, and that is, it's unseen work, and it often feels negated by a lot of what we do. So we really wanted to focus in on supporting our support people, and that really turned into us creating like a doula sisterhood. And so the team picture that you had saw earlier, we would spend time and weekly with each other to talk about our cases or talk about whatever they wanted to in the individual, and working with ourselves to help each other and work on how can we improve ourselves, workforce development, what are the concerns that our community is having, how can we be able to develop these resources and connect them to the community that is already out there. One of the unique things about our doula program, when we talk about workforce development, is really ensuring that our doulas are considered full-time employees. I know that there's a lot of different ways in which community doula programs are implemented throughout the nation. And what REACHUP has really advocated for is having like full-time positions, so that there's PTO, there is flexibility on being on call, and developing and investing into our community. A lot of our doulas that are represented in my team come from the community we serve. So we're really doing a full circle effect and helping them address a lot of their mental health concerns, where you want to connect them to resources. And I know that we can all relate that COVID has really impacted a lot of what we do nowadays. And perinatal, our mental health really needed to be addressed prior to this, but it was forced to be addressed after. The way we had to adapt to meet our community needs as well as our mothers' needs was challenging, but I think our doulas were able to hit it head on. Many of our concerns prior to the pandemic were related to just being able to have time to do everything. Now it's more concerned, like, I need somebody to talk to. Like, am I alone in this? Do other people feel this way? Where can I go talk to somebody about this? And it's really identifying that. And I think that during that time, we had a lot of players in the medical field, OBs, clinics, midwives, nurses, that started understanding the impact that our team and our doula community really had. And we were able to further develop those relationships. And we saw a lot better feedback from building those medical teams. And one of the things that we consider sustainability for our project and our community is to be able to amplify the voices of the lived experiences of our people. We wanted to use a social marketing tool that really helps influence health related behaviors and building on adoption of a doula as a holistic team. And that is part of what we want to do in our sustainability efforts for this program. Our definition might change in a year or two, we don't know, but we want to always be open to that feedback and ensuring that we are providing ethical, respectful, and supportive care to our community and building off of that. We talk about sustainability domains. I know that a lot of these domains, agencies, nonprofits, community-based organizations can really relate to the challenges that a lot of sustainability efforts can bring. one of the things, or two of the things, that we really focused in on specific to our project were the benefits to the community and users and stable funding streams and financial resources. Lessons learned based off of this is when we hear the word doula, a lot of implementation, there is evidence out there to indicate that doulas are supportive to better health outcomes. But when we're implementing these changes or implementing programs or community grassroots organization or grassroots initiatives in doula work, we need to make sure that we were not considering doulas like case managers. I think that it was really quick for a lot of programs to provide measurable data to function like case managers, but it was really important to our team that we distinguished doulas as their own member of the team. There's doulas, there's nurses, there's midwives, there's doctors, there's case managers. Each person has a unique role in their experience with a family member, and it was important that we didn't take more from our clients in our community than we were giving back to them. Our other focus was really that stable funding, as I mentioned, building on that workforce development. A lot of information is out there about, contracted doulas or getting paid per delivery as opposed to just getting hourly or salaried employees. We really like the model of workforce development and having full-time employees. It's worked well for us so far, and having them be a part of a team working with case managers, with Healthy Start, with Nurse Family Partnership, other community partners. We really have seen a benefit in providing that care and building a team off of that. And that has been some of the challenges in sharing that idea with others and seeing how they can implement it in their own communities. While it might be successful here, how can it be successful and sustainable in other communities? And I think this is also, we've been fortunate with the SEC project to have a flexible timeline and an open communication with our funders on adaptability to the changes and challenges that we may have had over the project. But those are some of the major challenges that we have had in building our medical home. But we have seen a lot of growth in the last year. And we'll continue to hope to do that with our sustainability project that we're currently working on right now. So the project that we are working on is really to create a video presentation of the qualitative work of our doula program and community. I think it's easy to be able to share with funders numbers, which I will share in a little bit. Like, we've served over 300 or enrolled over 400 women. These are the number of deliveries, our breastfeeding initiation rates, but it doesn't always fully grasp or really convey the idea of what we are able to offer to some of these families. And we want to be able to use that for advocacy tools to present to others. And if anyone here has ever worked with doulas, they're not your go-getters in the sense of being the biggest advocate of all the hard work they do. They're kind of like the unsung heroes or the silent heroes that don't mention all of the great work that they do. They're just happy in supporting those families in their birthing experience or the perinatal experience. So we want to build on the work that they've done, be able to talk about their downfalls, their happy moments. I know there isn't a lot of evidence there, but there's a lot of turnover for doulas. It's a demanding job, and it's a demanding career that's emotionally burdensome. And that was one of our goals, is to make sure that we're addressing that need, so we're not burning these individuals out that have such great hearts and souls. A little bit of our project is addressing specific questions, like doulas are often undervalued and underpaid. How are they going to be registered and considered valuable members of a medical team, and how are they important to this community? It is important that we're able to share this story that really tugs on the theme of what doula work can be and is. It is our goal to be able to use this as like a building stone for not just our project, for a lot of projects that the showcases doula work. And when I spoke about numbers, to supplement a lot of that numbers, as you can see on the screen, you want to be able to share these numbers in addition to a family story. The magnitude of helping one family through a labor, like, one delivery may not seem like a big deal, but labor can be days long. And some of our doulas can be there for hours on end. They might be there even longer than an OB or a nurse, a shift change. So we want to be able to capture those stories and really, really show individuals or community what they've been through and what we can help support them in doing so. One of the challenges that we have had with this specific project is like building on a creative team and collaborating with individuals that understand the message that we're trying to do, also within a funding restraint. What we want and what we can afford are often different things. And what we hope to do to accelerate our success, because we have had a lot of community support from the universities, the hospitals, and the clinics, is to be able to just like follow our team for a little bit longer. We've been doing doula work for over 20 years and we've helped thousands of women along the process. What we're hoping to do with this project is to be giving a snapshot into what we've been doing for such a long time. And really just to like surmise our overall goal is we want to help eliminate our health equities that our communities are experiencing. And health equities will often change. How do we create our village to assure that our communities are thriving? Our villages don't look like they used to. They're ever adapting, but we need to acknowledge that and acknowledge that there are a lot of individuals that have so much to share. And what is the best platform for us to be able to grow these sustainability efforts and promote our health equity? And that is it. That is, if you would like to reach me, I have provided my email and my contact information, and you can see our lovely team right there.